Hey everybody, welcome to another Facebook Live. I'm your host, Jess.
And I'm your host, Lauren.
And today we have a really great guest here with us. We're going to be talking about some of our healthcare programs and highlighting some in-demand careers. So it's going to be a good one, so definitely stay tuned. But first, before we jump into everything, Lauren is going to give us our Facebook Live etiquette. So take it away, Lauren.
Thanks, Jess. So thing number one, like Jess mentioned, we're going to talk a lot about our healthcare programs and in-demand healthcare careers this year. There's a lot of opportunity in this field. So if you know of someone, a friend or a family member who might be interested in learning more about getting into the healthcare field, please feel free to share this, tag them in your comments. All are welcome to join in on the conversation today. And if you have any specific questions or comments as we are talking, feel free to leave those in the comments and make sure you like and share and react. Please just don't put any personal information in the comments section or anywhere public on our Facebook page or any of our social media channels. Those are public, so we just don't want that getting out there for everyone. That being said, if you need to talk to us and you're a current student, you can call Student Services at 1-888-427-1000. If you are not a student yet but want to learn more about our healthcare programs or any of our other programs, you can call admissions at 1-888-427-6500 and speak to someone directly who can help you with all of your questions or things you want to learn more about. So that aside, let's get into the good stuff. We're going to introduce you to Jamie, who's the director of our allied health programs at Penn Foster. We're going to talk about why you should start a career in healthcare, what healthcare jobs are currently in demand, 3 healthcare programs to consider taking with Penn Foster. Of course, we have many more than 3, but we're going to talk about 3 key ones that we think will align with in-demand jobs this year. And why Penn Foster for healthcare programs and your healthcare education. So diving into it, Jamie, thank you so much for joining us today. Can you tell us a little bit about yourself and what you do at Penn Foster?
Absolutely. Thanks, Lauren and Jessica, for having me. As a director of allied health programs at Penn Foster, I oversee the strategic and operations of the healthcare programs at Penn Foster. That's a fancy and short way of saying that I make sure that all the programs that we have meet the learning needs of students, the hiring needs of employers and the community, and the different accreditation requirements as well. This means a lot of different things, of course. This means making sure the programs include all the appropriate content and skills, make sure students are successful in them, which includes ensuring we are hiring qualified instructors. Do students have easy access to contact these instructors? Is the student's experience in their student portal easy to navigate? There's, of course, a lot of things. We have more than 25 different allied health programs here. So MA, medical assisting, medical billing coding, and medical administrative assistant are some of our most in-demand programs.
Excited to talk more about those.
Yes, absolutely. So, before we even start jumping into the programs, why do you think that considering a career in healthcare right now is a great step?
Right. Wow, there are so many reasons why healthcare is such a great field and profession to get into right now. It is and continues to be one of the most in-demand industries. On top of the fact that we're living longer, access to healthcare has expanded with the Affordable Care Act. There's always new advancements in healthcare and that will require more healthcare professionals and different kinds of healthcare professions as well. There's also no geographical restrictions in healthcare. Everyone needs it everywhere, needs healthcare. And there's so many different healthcare settings that a healthcare professional could work in. Obviously, medical offices, hospitals, long-term care, rehab centers, and some fields that I think a lot of people aren't aware of, research, insurance companies. In addition to that, it's a great growth opportunity. There's so many opportunities to grow in this field. to upskill and to ladder. You don't have to invest necessarily 4 to 8 years and tens of thousands of dollars, take it from me, right out of the gate. For example, I know a lot of nurses and nurse practitioners that started out as certified nursing assistants, CNAs, that then went into becoming medical assistants, then became a licensed LPNs, and then became a nurse. Of course, there's many that actually went straight for it, but there's a great way to take a step into the field and then start to build and ladder into more advanced training and, of course, higher potential as well, higher paying potential. It's also, we can't underestimate how incredibly rewarding it is too. It's one of the few professions that you can directly affect someone's life, right? So if you're an altruistic person and care about people and like to be challenged every single day, the healthcare field is a perfect field for a person.
Those are all really excellent points. I think, like you mentioned, there aren't a lot of professions where you can live anywhere and have job opportunities and multiple job opportunities, probably multiple places where you can work, multiple, opportunities for growth and for figuring out where you want your career to go while you're helping others. So those are really good points there.
And yeah, I will add, and I think there's such a demand for healthcare, right? We're facing a big skills gap. There's a shortage of healthcare workers right now, and this was even before COVID, before the COVID pandemic. We've known this for like 20 plus years, that there is this really dire need in healthcare professions. What COVID did, unfortunately, was just exacerbate that need and really put a spotlight on our need for more skilled healthcare workers. This is certainly true for our need for physicians and nurses. That's been widely written about, but also other healthcare professions outside of these two. We often refer to these as allied health professions, and they're in great need, and maybe even in greater need than physicians and nurses, because there are I had to look this up a long time ago, and it might be a little outdated, but there are more than 5 million allied health professionals in more than 100 different professions, making up more than 60% of the healthcare workforce. So as you can see, that there's a huge demand for them. And these include healthcare professions that provide, that support the healthcare organization, everything from supporting and providing direct patient care to all the different administrative functions. That's everything from medical assistants, medical bill coders, medical administrative assistants, respiratory therapists, occupational therapists, phlebotomists, dental assistants, sterile processors, farm techs. I'm not sure if I can name all 100, but every single one of these professions are a very, very important cog in making sure every healthcare organization functions properly.
I think too, I feel like there's a stigma around going and trying to get your degree in the healthcare field. Everybody's like, well, I can't afford to become a doctor, or I can't afford to become, but those, you have those, but then like you're saying, there are millions of jobs that help facilitate and help those people, like the ones that we're going to talk about today in the allied services realm. And it's something that a lot of people, I'm sure, I'd love to work in healthcare. I'd love to help people and directly affect people's lives and keep people healthy, but that's not for me. I can't commit to that much schooling. I can't do, the money and all of the little factors that all factor into that. So I think that it's important that people do realize that there are healthcare jobs that are in demand that, don't require, like you said, tens of thousands of dollars and 8 years of your life.
Absolutely. That is absolutely true.
So with that being said, right now in 2022, what are some of the most in-demand allied health jobs that are out there and present a good opportunity for career exploration?
Well, probably certainly the ones I mentioned, and there's probably a reason why I mentioned a lot of those, because they're the ones that we have a lot of students enrolled in, but employers asking about them as well. Probably are some of our most in in-demand programs are medical assistant, medical administrative assistant, and medical billing coding, probably our largest ones. These are great programs to talk about because they really capture the different steps or phases in the healthcare process or the patient workflow, as I sometimes talk about, refer to it. That's when the patient enters the healthcare system to when they leave. Hopefully in a good way, but when they leave. Oftentimes, when you need medical services, the first person you meet is that medical administrative assistant. They may be the ones that often are the ones that schedule your appointment, greet you, have you complete all those really important forms, collects your insurance information. In addition to that, they're the ones that do a lot of the financials, collects your money. If there's a copay, help submit insurance claims, provide overall management of the medical office. Includes engaging with inventory, ordering inventory, and once the patient leaves the medical administrative assistant, the next person or the next healthcare professional that they'll meet is that medical assistant. Medical assistants, I really like because they are the trade of clinical and administrative oftentimes, but where they're really valuable are their clinical skills. The medical assistant is the one that prepares the patient before seeing the healthcare provider, the physician, nurse practitioner, physician assistant, and they assist the provider in any of the tests or procedures that might have to be performed on the patient. So this includes obviously taking vital signs, patient interview, taking blood, performing urinalysis and EKGs, assisting in minor surgeries, and depending on the different specialties. And I think there's maybe 100 different medical specialties that a medical assistant can work in, and a medical administrative assistant, obviously. There's so many other skills that a medical assistant can gain depending on those specialties that the person works in. Once they're seen and provided patient care by the provider, and the medical assistant supports all those steps. The next step is seeing the medical biller coder. And really the medical biller and coder comes in, and they're actually the one that makes sure that the medical office or the healthcare organization gets paid. Very, very important step, obviously. They actually have to understand what the patient came in for, obviously their diagnosis, and what procedures or treatment the patient received. And they have to understand that and be able to put it in a code, and a series of coding systems, basically. The most common one is the International Classification Disease, or ICD, and the other most popular one is our Current Procedural Terminology, or CPT. So taking all these codes and being able to communicate it with the insurance company to make sure that the medical office or facility gets paid. So all of these jobs, medical administrative assistant, medical biller coder, are essential in making sure the medical office or the healthcare organization effectively and successfully operates. Without them, everything just halts.
Yeah, I think all of the things you listed for the administrative assistant, that every time you listed one, I'm like, well, an office couldn't run without somebody doing that. An office couldn't run without somebody doing that. Without that person, every doctor's office or, medical facility needs those people, or it's going to be a mess.
Right. And everyone's role is expanding, particularly the medical assistant. As the need for nurses and physicians really gets stretched, they have to start looking at other healthcare professions, the support medical team, and that's oftentimes the medical assistant. And so their skills are starting to, expand, and their, what they're able to do is starting to expand as well. So I think oftentimes when we go into a medical office and that person, starts taking our vital signs and asking us all those questions and doing our injections and things like that, we oftentimes think that's a nurse. It might be for the most of the time, that's a medical assistant.
What do you think the importance of having a good education is before you even start to apply or get into these jobs?
Well, back in the day, as I like to say it, I used to call them homegrown, healthcare professions, where you could just grab someone right off the street and train them. Those days are really like slowly disappearing now, because of accreditation issues, liability issues. A lot of employers and state requirements are looking at healthcare professionals with the appropriate training and certification. And so it's a lot tougher for someone just to be trained on the job. It depends, but for the most part, a lot of employers are looking for, because they don't have time to train them, right? So they really need some new staff to be ready to go, ready to know how to have good customer service, how to ask the right questions, how to have critical skills, how to work an electronic medical record system, everything like that. So I think that's been really critical right now. So training programs have become just really essential, making sure that we have a workforce that's ready to go.
That's a good point, especially now, as I know a lot of healthcare facilities are very busy with all the things you mentioned earlier, a population that's living longer, more access to healthcare, the pandemic. They need people who can come in and be ready to do these jobs.
Absolutely.
So
right.
What sets Penn Foster's healthcare programs apart from maybe other options or other ways to get into these jobs and careers?
Not in any order necessarily, but I would say, first of all of the Penn Foster healthcare programs are accredited. They're accredited by DIAC, which is Distance Education Accrediting Commission. Hopefully I got that right. And accreditation is just really important because it ensures that we meet a national standard of competencies. And it's important for us to be able to communicate to students, to employers, to the industry that our programs, have the right competency, skills, knowledge that we're imparting to our students as they complete the program and they're job ready. And additionally, a lot of states and employers are looking for that national accreditation, to be licensed or registered in the state. And there's a growing number of states that are requiring accreditation and registration for certain healthcare professions, medical system being one of them for sure. Probably also that our content is, as I mentioned, to meet accreditation, employer and skill needs. We always start looking at our content to making sure that it's up to date. Is it meeting all the skills that a student will need in workforce, entry level, a job. I would say also certifications too, as I mentioned. A lot of our programs, particularly the three that we just talked about, are all aligned to industry certification exams. For example, medical billing coding. That's not required, but incredibly employer preferred that students who graduate from a medical billing coding program are certified in an exam that are certified. Basically, there's a few of them that they can take. For example, the CPC, certified professional coder, that's through the AAPC. There's the I'm trying to think, the CCA through AHIMA. The one that Penn Foster likes to and has been aligned to is National Healthcare Association, is the CBCS, Certified Billing and Coding Specialist. And that's a nationally recognized certification. And, students have done really well in that one. For medical administrative assistant, the one that they can take is the Certified Electronic Health Records Specialist through the National Healthcare Association, as well as the CMAA, which is also through the National Healthcare Association. That stands for Certified Medical Administrative Assistant. And I guess for medical assistant, they have a lot of options. There are a number of different certifications and registrations for medical assistants. Probably the top ones are the AMA, American Medical Assistant Association, which is the CMA. They have this NCMA. I won't go through all the acronyms. and things like that. But for our program, the ones that we really like to have students take is through the National Healthcare Association, which is the CCMA, the Certified Clinical Medical Assistant. And that's a nationally recognized, certification as well. So when students complete the program and they graduate, the great thing about Penn Foster is we pay for the voucher, which is, I think, a great benefit. Like, we not only give you oftentimes the certification practice exams to help you prepare for it, we provide you the voucher as well. I think also another thing is I would be remiss, maybe I'll back up for 1 second. I think another advantage to Penn Foster is because we're online. We're online, self-paced. And I think that really meets a lot of our students and a lot of people's, needs right now. I used to work from a ground campus, and it was really hard for students to make it on campus. They had full-time jobs, oftentimes more than one job, unfortunately. And they had family, young children, that they had to care for. Oftentimes they had transportation issues. So I think Penn Foster is a really great option for those students that really eke out 5 hours here, 1 hour here between, when their kids are, they're putting their kids to sleep, and before someone else needs to go to sleep, or when they wake up and their kids start waking up. So I think that's really great benefit for our students. And being self-paced, they can go as fast as they can want, or sometimes as slow. So if it's the summer, for example, kids are out of school, maybe they have to slow down a little bit. And when their kids are back in school, a student can pick up again. And I guess the last thing I'll say is, and I'd be remiss without saying, if I didn't include it, is our instructors. Our instructors are amazing, incredibly committed to student success. They are obviously incredibly qualified, decades of experience in the field. They're all certified, and they're so ready to help students. You can chat with them, email them. You can set up a one-on-one appointment with them. There's so many ways that you can talk to them, and they will spend the time to help you through the program. So sometimes I'm on Facebook occasionally, and I see students like I need help, and I just we tell them, talk to an instructor. So I think that's something that I love to remind students, talk to your instructors. They're ready and willing and waiting for your phone call, your email, your chat, for you to schedule an appointment with them.
That's such a good point. And I think the theme that we're here to support our learners is so important, I know, to us at Penn Foster. And what you're saying, it is self-paced, so you can go as fast or slow as you want, study on your own time, that's all fine. But when you do need help, you don't have to sit there and struggle. You can reach out, and there is somebody there to help you and support you. If you reach a milestone and you're really proud of yourself, tag us on Instagram, and Jess will share it out and we'll celebrate you. And, even in offering these vouchers for certification, it just is part of how it's not about getting you through the program. It's about helping you, get on your path to landing a job and beginning your career in healthcare. So that's what we're here for.
Right. Absolutely. I think for me, the 3 big measures of a successful program student is completing the program, getting certified, and getting a job. If those 3 things don't happen, I'm not sure, we're not doing our job. So I think you're absolutely right to making sure that we can help a student get to the next step. And sometimes it is to get a new job. It is to get a better job or enter a new field. And there are those students, which I really love, is they just want to learn more. They just want to learn more. For example, I might never become it, but I enrolled in our home inspector job, program because just out of pure interest. And we do have those students that just want to learn more. But I would say a majority of our students want to enter a new field or advance in their field. So we're certainly want to help them in their goals.
Absolutely. I think if it were, if I was a student and I was coming in and I wanted to do one of these programs, the things that would stick out for me based on, what we were talking about was, the accreditation. We did a whole Facebook Live a couple months ago just about accreditation and what that means and how important it is. And I think, we really want to nail home that we have those things. And if you get a degree with Penn Foster, you get your certification with Penn Foster, it is the right one. It is one that's widely accepted, and you aren't going to have an issue. Whereas sometimes, you hear horror stories about people going into programs and finishing programs, and then those programs aren't necessarily, widely accepted, and they're, in a rut. So I think the accreditation is number one. Number two, the instructors. I, read a lot of student stories, posting on, reading messages and Instagram posts and things like that. And one thing that's always stood out is that the students feel supported by their instructors. When you do reach out, they get back to you. They want to see you succeed, And three, the fact that Penn Foster gives the vouchers for these exams, that's another expense that you don't really think about when you're going through the program. You think, okay, well, I graduate the program, I paid for my program, I'm done. But some of these tests can be upwards of $100, $150 that you have to, put out just to get that certification. So the fact that Penn Foster helps in that way takes that little bit of added stress off, that you don't have to, put out another $100 after you finish just to be able to start applying for jobs. We help you with that. And I think that that's super important.
Right. Yeah, I think that's a great point, because as an employer, I can see there's a lot of different programs out there. And how am I going to tell, applicant A from applicant B, if you complete a program? If I knew this applicant A graduated from an accredited program, that I know that it met a specific standard. And I will say DEAC, which is our national accreditor, is a nonprofit approved by the Department of Education as accrediting body, is certified. Fine. How do I know this applicant got C's all the way through? Knowing that they, completed a program and are certified with the CCMA, CMAA, CPC, CBCS. I know that they just didn't, breeze through this and didn't really learn anything. It really proves to me like, wow, this person not only graduated with the right skills and competencies and knowledge, they were able to prove it too. So that's why I think certification is super important.
Absolutely.
Yeah, these were all really great points. And thank you, Jamie, for providing such great information today about the allied health industry, top careers, our programs, and how that can genuinely help all of you who are watching and thinking about the healthcare industry for you and your life. So again, Jamie, thank you so much for joining us today and sharing all of this super helpful info. For any of you watching, if you want to learn more about our healthcare programs, you can visit our website, pennfoster.edu. We have tons of information on there, or give us a call, and we're happy to chat through any of your questions or things that you have on your mind. But we appreciate all of you talking with us today, and we will see you soon.
Great. Thank you so much.
Thank you, Jamie. Bye, everybody.
Bye, everyone.